My name is Palmis Yahoo, and today I want to talk about something substantial in today's medical world: the key to staying healthy. It really is quite simple. However, millions of people around the world still do not see its value or are not well informed of it. I'm talking about preventative care and its power in today's medical and specifically dental world. Now, if there's something we all dread, it's going to the dentist. Now, I get it. I don't especially enjoy it either, especially when my mom, who's a dentist, takes a look at my mouth and gives me that look. You know, the one, have you been brushing properly? Most of us want to avoid going to the dentist. No one really wants to go. Actually, most people tend to treat it like it's going to a horror movie. Only difference is horror movies don't send you reminder emails every 6 months. But what if going to the doctor or dentist wasn't just about fixing our problems? What if it was about protecting our future health, ensuring that we can prevent the problems before they appear, before they hurt? Because let's be honest, most of us only go to the dentist when something hurts. And waiting until something hurts, that's like putting gas in your car when it's already on fire. It's not the smartest plan. In the past, dentistry was a very reactionary system. For example, in the 1800s, when you had a toothache, it was simple. Get drunk enough to numb the pain, find a barber, and get your tooth pulled out. That was that. The pain was gone, but so was your tooth. This reactionary system was like our root system. It helped fix the problems after they came, but it didn't prevent it or help us change our lifestyles. Today, we've grown from that knowledge. We've been able to grow our roots through different experiments and been able to help our trees branch out to the sky to create a more proactive healthcare, something geared to more prevention, because preventative care isn't just the best option, it's the most important one. Now, an example. In the 1900s, Sweden faced an epidemic of cavities. 3-year-olds were getting cavities in 80% of their teeth. Swedish scientists were asking why. Was it the sugar consumption? Were they not brushing? Or was it a sort of bacteria? Their curiosity led to one of the most unethical experiments in medical history, the Vipeholm experiment. The Vipeholm experiment consisted of them forcing patients with mental disabilities to eat different amounts of sugar at different times of the day. The experiment was very cruel, but the results were groundbreaking because they found out that the frequency at which you eat sugar was what was important, not the amount you ate. And so if you restricted or prevented the amount of sugar moments you had in a day, you would significantly decrease the chances of getting cavities. And although many of these cavities went untreated, this experiment was groundbreaking in preventative care because we can avoid certain diseases if we just take a good look at our lifestyle and habits. Now, a lot of us usually don't go to the dentist if there's nothing wrong. But nowadays, we do usually go for regular cleanings or to check with scans how the teeth are doing. Now, a lot of people only want to go and take scans if something's really wrong, but usually something like cavities are growing deeper beneath the surface. Let's take a look at this patient. Their teeth look white. It looks fine. But do you see these whiter spots here? These whiter spots actually indicate inactive cavities. And so at some point, this patient wasn't brushing properly and did start getting cavities. But this one back here, this white spot, is quite recent. And although these might seem superficial, something could be happening much deeper. Now let's take a look at the scans. Usually in a scan, tooth decay appears as dark spots. So what I mean is cavities. Can you spot any? Look at the amount of dark spots this patient has. And quite a few of them are already infiltrating the first layer of the tooth. And if this goes unnoticed, and the patient doesn't adjust their habits, their food consumption, or their brushing routine, it could get a lot worse. It could turn from this small white spot to this. Thankfully, we are able to today go to dental checkups to get regular cleanings. We can use fluoride treatments like your good old mouthwash, or have good oral hygiene habits like flossing, which I did promise my mom I'd do every night, but it's not just cavities we're able to detect before they become something much more serious. It's also gum disease. Let's take a look at this patient. Now, their gum looks quite intact, but the signs of gingivitis, gum disease, are already there. Red, swollen, and prone to bleeding when flossed. They especially look red if we compare them to this patient. Look at how beautifully pink their gums are. Thus, if the infected patient were to go unattended, it could lead to serious bone loss. You might think, gums to bone loss? Yeah, the infection can really get through your gums and to the bone loss, especially this bone, the mandibula. Your bone level could go from this to this, making it incredibly difficult and painful to speak or eat. But this shift in preventative care isn't just exclusive to dentistry. We see it in medicine as well. Blood pressure checks before strokes, cancer screenings before symptoms, and mental health care before breakdowns. All of this helps grow our roots and help us build a more proactive foundation. But if preventative care is so good, why doesn't everyone just do it? Well, it's not that simple. For example, the cost of preventative care, especially in dentistry, can be quite a bit. For example, in the Netherlands, up until the age of 18, dental care is free. It's included in your basic healthcare package. But the moment you turn 18, it becomes a cost you have to pay outside your healthcare. It becomes something additional that a chunk of the population can't afford and thus don't make use of. And so people in socioeconomic groups, in lower socioeconomic groups, don't have access to good preventative care or are not aware or educated of good oral habits because they don't go to the dentist. And preventative care starts at home. So if the parents aren't aware of this preventative care, the children will miss out. Also, fear, because let's face it, most of us are quite afraid of the dentist. But the truth is, if you don't take proper care and if you don't go to your regular checkups, you might need more invasive treatments than you might have thought. So all that drilling you're so afraid of, yeah, that's going to happen. And lastly, a lot of people have the mindset, well, if there's no pain, I don't need to worry. No pain, no problem. And that's where the danger lies. Even though, as I showed you before, even though the cavities or the disease might look superficial, it could have infiltrated more of the tooth or the gums than you have realized. And by the time you try to fix it, it could be too late. In general, the way the industry of many countries think about healthcare is also just wrong. In, for example, the US, the healthcare system and industry, like pharmaceutical companies, are all geared towards bandaging problems. When a patient comes knocking, the healthcare specialists have no problem giving them a bunch of medicine, this, that, but they don't address the root of the problem. They don't address the habits and lifestyle of the patient. You must understand that if you want to avoid having healthcare complications, it's important for you to take good care of yourself. For example, staying active to ensure that you stay in shape, or something as simple as applying sunscreen every day can significantly decrease the chances of getting skin cancer. The future of preventative care is growing, and technology is helping us branch out a lot. Imagine this. AI algorithms that can help us detect little problems just with a few scans or photos, which can detect cavities, gum disease, or other infections. Genetic testing that with the swab of just your saliva You can already see what you're at risk for and stop the symptoms before they show up. Also, online consultations, which were very popular during the COVID era, but allow patients to have access to medical care without having to step into a clinic. Also, something I personally believe should happen in many countries is that dental care should be included in the basic healthcare package so that everyone has access to the preventative care they need. Public health care and public health agencies should be geared towards helping everyone. And so that people, even though they don't have enough money or no matter their background, can still get access to the care they need. So we've come a long way from barbers pulling out our teeth or waiting for the pain. We are constantly growing. We're growing from the roots of education and awareness into branches, good, healthy branches of innovation, accessibility, and well-being. Preventative care isn't flashy, but it's powerful, and it's how we build a healthier and more resilient future together. Thank you.